We're here this morning to launch a committee to conduct a review of the levels of health and care delivery at the regional health authorities and to rationalize the system of public sector doctors in private practice here in Trinidad and Tobago. And in this regard, I will now ask to come to the podium the Permanent Secretary at the Office of the Prime Minister and Head of the Public Service, Ms. Sandra Jones.
I warmly welcome you all to this morning's ceremony to hand over letters of appointment to members of the Cabinet-appointed committee to review the levels of healthcare delivery by the regional health authorities and to rationalize the system of public sector doctors in private practice. Further, the committee will be charged with conducting an assessment of the delivery of healthcare by the regional health authorities and the identification of the major issues surrounding its deficiencies. Additionally, the committee will review the system and framework governing doctors who pursue private practice while employed in a public institution. I take this opportunity to thank the members of the committee for agreeing to serve in this capacity. The government of Trinidad and Tobago remains committed to reforming the current healthcare system and establishing a modernized system that will provide the citizens of our nation with proper standards of healthcare. Ladies and gentlemen, I thank you and God bless.
Honorable Prime Minister will now be presenting the letters of appointment to the respective committee members. Firstly, the Chairman, Dr. Winston Welch. Dr. Wayne Frederick. Professor Carl Theodore. Mr. Charles Martin Degans. Dr. Adesh Surjising. Ms. Valerie Allen Rollins. And Dr. Albert Posada. Thank you, Prime Minister and PS. And we now ask for a response by the Chairman of the committee, Dr. Winston Welch.
Thank you very much, Honorable Prime Minister, for reposing confidence in us to do justice to the exercise at hand. Also, to the Honorable Minister of Health for his endorsement and his supportive presence here today. I anticipate and feel comforted that each member of the committee is prepared to do whatever it takes to satisfy that confidence reposed in us. Exercises of this nature are hardly ever simple, but in addressing the complexity, it is our resolve, consistent with what the Honorable Prime Minister has alerted, that this is not a protracted exercise, but is one that's meant to be practical, to the point, and solutions-oriented, and of course delivered on time. Matters of health touch and concern each and every one of us, and can generate the whole gamut, the whole spectrum of human emotions, not excluding, of course, anger and hostility, to which some of us have already been subjected, but I presume that's par for the course. This undertaking, as I understand it though, is not one that is aimed or geared prejudicially against any one group, but is geared towards establishing the right balance in the delivery of health care to a deserving population. And to that we are indeed committed. We look forward to the cooperative effort of all concerned. We wish to express our thanks even at this early stage to those who have been part of that formidable team that have contributed to the exercise thus far. We wish to thank you sincerely. And of course, to the members of the team, I say a very special welcome on board, and I take the opportunity on your behalf, on our behalf, to say that we are committed in the service of Trinidad and Tobago. Thank you very much indeed.
And now we would have an address by Dr. the Honorable Keith Rowley, the Prime Minister of the Republic of Trinidad and Tobago.
Thank you very much. Good morning, PS, members of the review team, senior staff of the Ministry of Health, Ministry of the Office of the Prime Minister, members of the media. A good point of departure for my comments to you this morning is an observation I just made in the newspapers, which says that the current administration appears to be a government by review, or that governance by review is the modus operandi of this government. And I was trying to figure out if that was a criticism or a compliment. I take it as a compliment, because we have been doing a lot of things in Trinidad and Tobago, and we have been spending a lot of money, and we have been receiving a lot of complaints about what we have been doing, the monies we have been spending, and the dissatisfaction associated with our efforts. And therefore, I think the doctors, more than anybody else, or the healthcare givers in general, would agree that before one can properly, if not accurately, prescribe, one has to diagnose. And before a proper diagnosis is made, one needs to understand the situation, the presentations, and so on. So we are not put out by the idea that we are reviewing the status of the country's efforts. I want to reiterate what Mr. Welsh just said, and that is that this is not aimed at anybody or any particular group or any sector. This is an exercise for the national community to get a good understanding of what is working and what is not, what is underfunded and what is costing too much, what is available and what is unavailable. And at the end of adding up all of that, it really is, how can we do better with what is available to us? And if that generates a work plan, recommendations, proposals, or any action which results in the improvement in healthcare, then the exercise would have been long in coming, but well worth it. Those of us who have been around the government's allocation process for quite some time, and I've been in cabinet since 1991. And I could not help but observe the allocation to health and education. And I've been here continuously since then, and I've seen it grow. And we have been making the allocations. I've seen the expectations grow as well in the national population. But at the end of the day, I have to admit to you that as Prime Minister of Trinidad and Tobago today, at the end of that long journey, I have come to the conclusion that both in the area of education and health, we have been spending more and more money and getting less and less output. Less and less education and less health care. And I believe that is because some of the systems are inherently unworkable. And therefore, if that is so, in my cursory diagnosis, well then maybe if there are changes, major or minor in the systems, if there are audits that show where the weaknesses are, then the potential for improvement exists. Healthcare is probably the most political issue in the United States. In the political arena, you hear so much about healthcare because it's an economic driver. It's also the area where people look, no matter wherever you fall in the national community, someday, sometime, you have to interact with, or you always have the expectation that the healthcare system is where you're going to end up sometime, either as a parent with a child, as an individual with an ailment, or as a professional with a career to advance. So the healthcare is big. I think it's now our third largest in terms of allocation. Right now we are, unfortunately, national security is number 1, education is number 2, and I think healthcare is number 3. We have to look at what we've been doing. I was in the cabinet when Minister John Eckstein advanced and piloted the RHAs as a response to this same problem that I just described. We engaged in breaking up the health system into a series of regional health authorities because the Ministry of Health was deemed to be a monolith that was unmanageable. I am not sure, from a personal standpoint, that the coming of the RHAs have in fact brought with it any significant improvement in healthcare delivery as compared to what the ministry might have done over the same period of time with the same resources. If I am wrong, then we need to know. And if I am right, then we need to know. And what this exercise is meant to do is to give us some kind of answer to that observation. Unfortunately, good things don't make the news very often. Bad stories do, all the time. And we see so many stories coming out of the RHAs, whether it's management, whether it's attitude, whether it is funding, whether it is physical plant. But usually when we hear about the RHAs, it usually is a bad story. And then eventually, cynicism takes over. Our healthcare delivery in this country is not obsolete, it is not antiquated, but it attracts a lot of dissatisfaction and a lot of questions. And then sometimes we get questions as to whether, in fact, there are corrupt practices within the system or conflicts, inherent conflicts. What I've done as head of the cabinet, with the approval of the cabinet and the support of the Ministry of Health, we have asked a group of citizens who are experienced and qualified to look at this problem, this national problem, dispassionately. Not review, because maybe you don't have the time to review the previous examinations. I think 10 years ago we had a commission of inquiry into the healthcare system. And there were great expectations of that inquiry. Unfortunately, I don't know that that inquiry resulted in any sea change in healthcare delivery in the country. This, what's going on here now, is not a commission of inquiry. And we're not even asking you to review the commission of inquiry, but we're asking you to note it as a resource. And the people who we've asked to do this, I want to thank you very sincerely at the individual level for agreeing to take on this assignment. Because as Dr. Wells said, it wouldn't be uncommon or, how should I put it? It wouldn't be a surprise if you are subjected to negative comments, but I know you can deal with that. You deal with patients, you deal with blood, you deal with infections, and you deal with cure. So I'm sure that you all can deal with that. But I want to thank you all for offering to do this public service. And I may say to the public that we have not discussed compensation. And persons who are prepared to take on assignments like this without contract or compensation are people who we have to welcome and give thanks to, even before we get the report. So today, the Cabinet would wait on your exercise, and I am appealing to all persons, members of the public included, who have some contributions to make to a successful outcome to this exercise, to do so with an open mind. I'm appealing to the caregivers in all our institutions, not to treat it as a sounding board for complaints, but to treat it as an occasion to make valuable criticisms and recommendations, because it is the government's intention to act upon reasonable recommendations which we expect to come from this. We hope that we can get your first report, and by first report I mean there may be other reports, because the healthcare sector is wide and it's deep. And we don't expect that in 5 or 6 months we will cover and complete and close the lid on this matter. It more than likely would be more ongoing than being conclusive by the end of April, which is the time that we anticipate your first report, interim as it might be, can come to the government, so as to guide us at the time of the mid-year review and going forward to do anything that we may do to bring about changes. And then there are a lot of young people in the healthcare system. And this, what we're doing now, hopefully could provide some guidance and some stimulus to them to have faith in the career that they embarked upon, and to see their service to the wider national community as being crucial, because healthcare delivery and the good health of the nation is right there with the security of the nation as our top priorities. If I may single out one person in the group who have agreed to do this exercise, I want to single out Dr. Wayne Frederick, who, as you know, is one of our distinguished sons who've done well abroad. He's the president of Howard University, which has an excellent health program and other programs associated with healthcare delivery. And in putting the team together, I wanted someone in the team who is at a distance from us to be able to look at us with a distant eye, not being part of the local arrangement. And when I asked Dr. Frederick if he could find such a person for us, I was pleasantly surprised when, in his sense of patriotism, he said, "I will do it myself." So Dr. Frederick, I want to thank you very much. And we, the people of Trinidad and Tobago, should be particularly proud to have produced a son who has gone on to where he is and who has said he will do it himself. So he's here with us today and will continue. And our association with Howard University, I hope this is the beginning of good things in that direction. Let me just read for you specifically the gist of the terms of reference and what we expect and what the population can look forward to as we go forward here. The Cabinet has appointed this committee with the following objectives. 1, to audit the current manner of operation of the regional health authorities and its ability to provide quality health care with emphasis on value for money. 2, to rationalize the system or systems and framework governing healthcare givers, particularly doctors, who pursue private practice and investments while employed in a public institution. In so doing, the committee has been requested to 1, note the outputs and recommendations emanating from previous reviews and studies on the health sector. 2, conduct stakeholder consultations with persons employed in the RHAs and other health institutions, even the private ones, to ascertain their views of this dual system of operation by healthcare practitioners. 3, develop a framework to govern the arrangement whereby doctors are permitted to practice in both private and public health institutions in order to minimize the operational conflicts that currently exist. 4, recommend standards of care by which doctors who operate in both areas of healthcare system are to be governed in keeping with the renewed vision for healthcare delivery in Trinidad and Tobago. 5, to co-opt persons and institutions whom, in its view, can further the objectives of these initiatives. However, the committee will be given the flexibility to recommend any adjustments to its terms of reference that it considers necessary. I also want to show you that the Ministry of Health stands ready to support the work of the committee with whatever resources, both technical and secretarial, that is required. I look forward to receiving the reports of the committee and most especially its recommendations for action. The committee is expected to produce its first report by April 30th, 2016. And I dare say the committee's documentation reports will be made open to the public. You'll report to the Office of the Prime Minister, but whatever you say to me will not be a secret to me. It will be immediately made known to the national population for its digestion and its comments as well. So we as a nation will know what we're being told, and the government will be observed for what we do in response to what you're telling us. So I wish you all a very successful period of service, indeterminate as it might be at this time, because I'm sure that in 5 or 6 months, you will be saying to us that you need more time to do more work. So on behalf of all the people of Trinidad and Tobago, thank you very much for agreeing to serve on this committee.